Welcome to the What's Happening Birmingham video podcast.
Hello everyone, this is Jarvis Escott with What's Happening Birmingham. Today I have the honor and pleasure of being with Dr. Jamie Bell.
Hi.
Jamie is a good friend of mine. I've been knowing her for years.
For maybe 20 years.
Yeah, 20 years.
Yeah,
20
we
years.
can know.
Yes. We go way back. But I want to bring my good friend on today because we're talking about a very important topic because this month is Colon Cancer Awareness Month.
Absolutely. March is Colon Cancer Awareness Month.
So, Doctor, thank you again.
Thank you for having me.
Great. So, reason why I went back to what I said earlier, I want to bring her on because we want to talk about this important topic and what you need to do and why you need to go get screened.
Absolutely.
So, first of all, what is colon cancer, the medical definition?
Colon cancer or colorectal cancer involves cancer of the colon, which is the large intestine, and also includes the rectum.
All right, so with colon cancer, let's dive a little bit more deeper in. When I hear terms like, what is the polyp?
Okay. Yes. So a polyp is it's a mass or it's a growth that can be found in the colon. And the reason we're talking today is Colon Cancer Awareness Month, and I want to encourage everybody to get a colon screen if they meet the criteria. So I'm going to kind of jump ahead, Jarvis. We're probably going to definitely get to this, but the main way to determine if someone has cancer or is at risk for colon cancer is what's called a colonoscopy. There's some other tests, but the colonoscopy is actually where they go into a doctor, a GI doctor, typically a gastroenterologist, would give some patients some medication to sedate them. They take a tube and they look up somebody's rectum into their colon. If they see something called a polyp, which typically, initially a polyp is benign, it's not cancerous, it's just a growth, but it can become cancer. So if they go in there, do the colonoscopy, and they see a polyp, they can remove it and potentially decreases someone's risk of getting cancer exponentially. Polyps, like I said, they do turn into colon cancer. So many times they do. So that's why having a colonoscopy and doing that early screening is very important.
So what's the common causes?
The common causes of colon cancer are age. African Americans are at more risk than other races or other groups. If someone has something like Crohn's or ulcerative colitis, there are certain diseases, they put them at extra risk. In addition, drinking alcohol, smoking puts people at risk for colon cancer.
So those are the most at-risk factors for it. So I want to go back earlier when you was talking about the colonoscopy because we hear that term a lot.
Absolutely.
Can you walk us through the process of how to get that done? Because I've heard so many different things, like you have to drink something and at certain time intervals and things like that.
Well, yeah, that's a good question. Most people are fearful of colonoscopy, but then after my patients have it done, most of them say the colonoscopy wasn't the part that was the problem. They said the prep for it was the problem. So usually when people get 50 years of age, if they have no other risk factors, at 50 years of age, we recommend all patients to get a colonoscopy. Because we feel that that's the age that if we start doing it at 50, we can potentially catch a polyp or any kind of risk of colon cancer before it becomes colon cancer. So usually what the doctors do is they bring you in, they talk to you, they give you something to drink to basically clean all the poop out of your system. It's called a prep. Sometimes they do it, you just do a 1-day prep, sometimes you have to do a 2-day prep. That gets all the poop out of your system, so when they take you to the procedure room for the colonoscopy, your colon is cleaned out. So once you do your prep for 1 or 2 days, however many days they think is necessary, you have your appointment with your doctor. The doctor gives you some medicine to sedate you, so you're kind of sleepy, so you don't remember the procedure. So it's important to also bring someone with you that drives you to the procedure so they can drive you home because you'll be under some anesthesia. While you're sedated, they do the procedure. It doesn't typically take that long. After the procedure, you go home the same day.
All right. So I want to go back to, let's just say after you had the test and something is discovered, what kind of options or what the typically doctors would tell you the next steps?
Okay, so usually with polyps, most polyps they can just remove actually during the colonoscopy, and then they tell you, hey, you come back in a certain amount of time for your follow-up. If your colonoscopy is stone cold normal, usually they tell you 10 years. If you've got like a risk factor like family history, maybe you've got a brother, a sister, a parent, or somebody that's had colon cancer and yours was pretty clean, they usually tell you to come back in 5 years. They may tell you to come back in 5 years if you had some polyps that weren't too concerning. Sometimes it could be a sooner return based on what they find. In the event that they find a polyp and they send it to the lab to look at it under a microscope where a specific doctor looks at it, say they figure out it's cancer, treatments can be anything from removing part of the colon It could be chemotherapy, where you take medications, or it could be radiation,
All right, so
or a combination of those.
okay. So one thing I was thinking about when you was mentioning that colonoscopy, a lot of people, do you feel like a lot of people confuse that with getting the prostate check?
That is a great question.
Okay.
Yeah, because that's so important, because I have a lot of patients that I believe in educating patients and letting them know, because when somebody's getting a prostate exam is for prostate cancer. Men can only have prostate cancer because women don't have prostates. So one thing that they may do for a prostate exam is we call it a digital rectal exam. It's a finger exam, where basically they enter the rectum, and the doctor, that's the easiest way for the doctor to feel what a man's prostate feels like. So because the entry is the rectum, people confuse that with a colonoscopy, and they're two totally different tests.
So what are some myths that you have heard where you have potential patients come to you about just colon cancer, colonoscopy? You'd be like, no, that's not true. And I know, of course, I'm going to throw this out. Google is the devil.
Google is the devil.
Because the first thing people go, like, something wrong with, they're going to Google it.
Yeah.
And things, so.
Well, most people tell me, I've heard a lot of people say they don't want the colonoscopy, and they'll say, I don't have any problems. I don't have any blood in my stool. I haven't had any weight changes, because sometimes when people have cancer, one of the main things we notice is that they've started to lose weight. But I tell patients, just because you don't have blood in your stool does not mean that you don't have colon cancer, because in addition to having risk factors, sometimes people have no symptoms at all. So that's why we encourage the screening, because hey, by the time you have some symptoms, you could be further along in the disease process.
All right, and something that's just thinking in my head, I know a lot of you probably thinking like, you heard this information, like, I need to go get tested, but let's just put this out there. I don't have no insurance. Are there places that you know of that people can go? I know, like, health days, they can go and get tested or treated or things like that.
The first thing I want to tell people is you need to establish care with a primary care doctor. I know insurance is an issue for a lot of people. Insurance is extremely expensive. There are still some places around. I know we used to have Cooper Green, and I think Cooper Green still functions in some fashions. But there are places that you can go to that maybe do healthcare based on income. So you maybe do a sliding scale fee. There's some doctors that only take a cash practice. One of my good friends only has a cash practice. So those are some things that you may need to look into. And once you get with that primary care doctor, he or she can direct you towards what's the next step if you need a colonoscopy.
All right. So.
And help in getting you one that's affordable.
Oh, okay. Yes, definitely affordable. One thing that, whether you're looking at your doctor's going to tell you, and this next subject I know you're very passionate about, is to kind of avoid this healthy living and the importance of eating healthy foods. To kind of, I'm not going to say,
so well.
Yeah, it's not going to carve off this, but what could you recommend to people like, you may need to stay away from that because that could cause it?
Absolutely.
Because a lot of people say red meat all the time.
Red meat, high fat diets. I'm never going to be a doctor to tell somebody you can never have a steak, or you can never have pizza or anything like that. But we've got to be cautious of how we eat things, and we've got to eat in moderation. Clean living, clean meats, fruits, vegetables, fish, things like that are always better options. And making sure you eat balanced meals, drinking lots of water, limiting your alcohol intake, not smoking. Smoking is just puts you at risk for so many diseases.
And also another thing I want you to kind of speak on, kind of briefly, is a lot of people do these cleanse, and they get these, things they order online, and just kind of tell people the danger sometimes behind just doing that, because usually, this is just me just thinking, Jarvis, no doctor, is that, you take that stuff and your body not used to it, it can cause all types of
I think we need to be very cautious about things that we take and things we buy online, things we even buy in a store over the counter, because a lot of things that are on the market, that are out there, may not be approved by the Food and Drug Administration, which means they have not been evaluated, they have not been tested, and many times you don't know what you're getting. I would be very cautious about anything you put in your body, whether you put it in your mouth, or especially a lot of people are doing these cleanses where they enter things through the rectum. When you're putting something through the rectum, the doctors, when they do these colonoscopies, they have been trained for years. 4 years of medical school, maybe 5 years or more of residency, more if they do a fellowship. They know what they are doing. And if you were to do a procedure by somebody who's not trained or not a professional, you could do some damage. What if you put a hole in your colon? And that's a medical emergency. That's life-threatening. So I think we need to be very cautious about the things that we're doing and the things that we buy. Always ask your doctor. Get your doctor's approval. They're going to be the expert in that field.
Yeah, they treating the rectum like it's a entry and it's supposed to be an exit.
It's an exit, yeah.
And everything. So, kind of, going back to what you were saying earlier, as far as like, the healthy living, water, drinking.
Lots of water. 60 ounces a day.
16 ounces a day. Woo.
60.
Six zero.
Woo.
Woo.
For the average person, yes.
So, laxatives are completely different from a cleanse, correct?
Yes, and you've got to be careful with laxatives because there's a purpose for them. If you're getting to the point to where you can only have a bowel movement, if you use a laxative, you need to be talking to your doctor about that to make sure some other things aren't going on.
So how many bowel movements you supposed to have?
It depends. It depends on the person. And that's interesting because a lot of people suffer from constipation, and it's a chronic disease that a lot of people have, and they're embarrassed by it. I say, you should have a bowel movement every day. It's normal for some people, maybe every other day. So it just depends on the person. But if you're going like weeks, months, that's a problem.
All right. So now that we got this information out of the way, I know you all have seen her face around town or known her for years. Probably a lot of people watching the video right now like, I've known Jamie growing up. Let me first off say I'm so proud of her.
Thank you.
I'm
proud of you too.
Yes, and
I love to see people succeeding.
She is very passionate about this field. So the question, I've always asked you, before the camera, why did you decide to become a doctor?
Growing up, my parents were very supportive, encouraging. It was never, are you going to college? It's, where are you going to college? That type thing. And I remember being 5 years old. I went to Holy Family Elementary for elementary school. And I remember for our kindergarten graduation, we had to tell like what we wanted to be when we grew up. And my pediatrician was Dr. Jacqueline Stewart. She's local here in Birmingham, practicing probably 40 years. She was my pediatrician. She's my daughter's pediatrician now.
Okay.
And I wanted to be just like Dr. Stewart.
Okay.
I loved going to the doctor. I loved how she cared for me. And she became my mentor. And ever since then, at first I wanted to be a pediatrician. But now I just stick to the adults.
Okay.
I love kids, but when you deal with kids, you got to deal with their parents too.
Oh, so, man. That is
but yeah, I love taking care of people. I love educating people because we get one body and it's the only place we get to live, and we've got to live there for the rest of our lives. So, and say, hey, if I create healthy adults, they'll be able to take care of those kids, right?
Yes.
Right.
So, how do you handle? Because especially with you being a doctor, and I think lawyers can kind of relate to this, and dentists. How constant sponge of information. Do you ever find your friends always asking you health questions? And do you be like, well, have that disclaimer in your head? Y'all probably gonna see the disclaimer before we start too.
That's right.
There's a medical disclaimer.
There's a medical disclaimer.
This is just advice. Don't
just advice. Run everything by your personal physician.
Yes. So how do you handle that?
Well, medicine is a ministry for me. I'm very passionate about what I do. I got a lot of questions from my friends. I answer those questions. Obviously, certain times I say, hey, I'm quick to say, hey, you need to talk to your doctor about that, or you need to go see your doctor about that. But I don't mind sharing. I mean, God gave me this talent and this ability, and I'm supposed to use it and help other people. I feel like I'm just the vessel through which he works. He's the real doctor. I'm just his hands and feet right now.
All right. So where are you today? I mean, where we are today. Well, yeah, you're the health system, but like as far as your career.
Yeah, I'm a full-time family medicine doctor. I'm employed by a local employer. I work Monday through Friday, family medicine. But I typically see adults. I see patients with blood pressure, diabetes, cholesterol, patients who have a history of cancer, thyroid disease, heart problems, and all that kind of thing.
All right. So, any last thoughts you want to add?
No, I just want to encourage everybody to, like I said, take care of yourself. You get one body. It's the only place you have to live. And this body's got to last your whole life. So be good to it. Take care of it. And remember, an ounce of prevention is always better than a pound of cure.
All right. So, Jamie, thank you again.
You're welcome.
Dr. Bell, I would like to add.
My friends call me Jamie, so it's good.
Yes, if you see her around town, trust me, you can walk up to her. You can always ask her questions. You know, you need that. And, you know, one thing I was just thinking about on my way here is like, what you don't know can kill you.
That's right.
But what you do know can save your life.
That's right. That's right.
So you always got to keep that in mind when it comes to your health, because a lot of times people be so afraid.
And there are no dumb questions. I tell people the only questions that are dumb are the ones that don't get asked, because if you need to know, if you don't know something, you need to know, and you still should feel comfortable asking somebody with that knowledge without being belittled.
Okay. All right. Well, Jamie, thank you again.
Thank you.
March, don't just say, you know, you want to go get checked. If you need a check in July,
that's
go
right.
Check in July. Need a check in December.
Merry Christmas.
Yes.
That's right.
Please do not just wait, because
Don't wait.
You don't want to wait till the last minute. Trust me, y'all, because it's, you know, just need to wait till the last minute. So, Jamie, thank you.
Thank you for having me. It's an honor.
Thank you, friend. I'm just so proud of her.
I'm proud of you too, Jarvis.
So proud.
Thank y'all.
Thank you all again, and check out what'shappeningbirmingham.com for more videos, and also check out the YouTube channel. I need y'all to subscribe. Thank you all again, and bye-bye.
Bye-bye.
Thank you for watching the What's Happening Birmingham video podcast. Please check out our website, app, or subscribe to our YouTube channel for the latest videos today.